Over 370 million people worldwide are estimated to be diabetic. For many, the diagnosis can mean years of different drug and insulin therapies, and in extreme cases, even surgery and amputation. Well, at least one expert here in Israel is asking, what if all we know about diabetes treatment was wrong? And here with more is Dr. Mariela Glandt, endocrinologist at the Glandt Center for Diabetes Care. Thank you very much for coming in.
Glad to be here.
So let's answer the question. Let's start there. Is it wrong?
Well, I wouldn't be so dramatic about it, but
Sure.
I would say that we have to reconsider how we're looking at things. So we're always trying to patch things up and trying to give more and more medications, when actually the problem is that we've eaten too much sugar and the body's
Sure.
saying, stop this madness, don't bring any more sugar into the body. That's insulin resistance, which is the basis of diabetes. So if we just take away the sugar, then actually things fall into place.
So you're not advocating really the use of insulin injections and all these other medications?
Well, the problem with type 2 diabetes is that there is a lack of response to insulin. The body is, again, rejecting the sugar.
Right.
So you can give more insulin and try to push the sugar in, but it's actually going against the body's will. The body is not interested in
Actively telling you, I don't want
right.
insulin, so I
It's a
didn't make
problem of too much insulin to start with.
I see.
So by giving more insulin, we actually make the problem worse. We actually increase the abdominal obesity, which is the problem. We increase blood pressure. There's like a strong connection between insulin and many chronic diseases.
So what kind of treatment, what is the best treatment that you are advocating for diabetic patients?
Yes. Well, first of all, take away the sugar. Okay, take away sugar comes in many forms. Pasta is sugar, rice is sugar. Right. There are many, bread is sugar. So it's not just like, oh, people are like, I don't eat sugar. Well, you do, but you don't realize that a potato is all sugar. Exactly. Yeah. Well, not everything. So that's the thing. There are a lot of options. Sure. The problem is when we try to decrease the sugar, the carbohydrates, as well as the fat. So the other problem is the fear of fat that we've inculcated in our minds for 50 years.
Sure.
So if we are also...
it's, some fats are good, some fats are bad, but we all think fat is fat.
Right, but it's not quite,
Sure.
Actually healthy, natural fats, things that are not processed are just fine. So you can have as many eggs as you want, you can have butter, you can have chicken meat,
So,
fish.
okay, I just wanted to make sure that we got this in, so would you advocate for really specialized kind of diet and lifestyle changes, or is there any sort of kind of basis advice that you can give to people who suffer from diabetes?
Well, I would say that diet is above and beyond. It's like number one.
That's everything.
Yes, it is. It's not everything. Exercise plays a role, but I think a secondary role, because in order to really get rid of the sugar, you have to change the way you eat. And yes, you've got to start with. It's a disease caused by too much sugar. The only way to treat it is to get rid of the sugar.
All right. If for more information, please visit www.glandt.co.il. I'm sure there's much more resources there.
Yes.
Dr. Glandt, thank you very much for coming in.
Well, thank you for having me.